The thorax, a muscular powerhouse. Our thorax, or chest, is a busy area. It houses vital organs like the heart and lungs. It also provides the power for many of our daily activities. Muscles in the thorax are essential for this. These muscles are broadly categorized into two groups, extrinsic and intrinsic. This categorization helps us understand their primary functions. Extrinsic muscles have attachments outside the thoracic cavity. They are involved in moving the upper limbs and assisting in breathing. Intrinsic muscles, on the other hand, are located within the thoracic cavity. Their primary role is to support breathing. Understanding the difference between these muscle groups is important. It allows us to appreciate their individual roles in our body. In the following sections, we will delve deeper into each group. We will explore their functions and significance. Reaching out and breathing in. The extrinsic muscles. The extrinsic muscles of the thorax are true multitaskers. They contribute to the movement of our upper limbs and play a crucial role in respiration. One key muscle is the pectoralis major, spanning from the chest to the shoulder. It helps us push and lift objects and assists in chest expansion during deep breaths. Another important muscle is the serratus anterior, named for its serrated appearance. It originates on the ribs and inserts on the scapula, aiding in scapula movement. This is crucial for actions like reaching overhead or pushing objects. These muscles highlight the interconnectedness of our musculoskeletal system. The core of breathing. Intrinsic thoracic muscles. Intrinsic muscles are the primary drivers of breathing. Located between the ribs, they expand and contract the chest cavity. This action moves air in and out of the lungs. The intercostal muscles are a prime example. They are organized into external and internal layers. External intercostals move ribs upward during inhalation. Internal intercostals pull ribs downward during exhalation. These muscles ensure a constant oxygen supply. Section 4. The diaphragm, our primary breathing muscle. No discussion about thoracic muscles would be complete without mentioning the diaphragm. This dome-shaped muscle sits at the base of the chest cavity, separating the thorax from the abdomen. It is the primary muscle responsible for breathing. The diaphragm contracts during inhalation. This contraction flattens the dome and increases the volume of the thoracic cavity. This creates negative pressure that pulls air into the lungs. During exhalation, the diaphragm relaxes and returns to its dome shape. This decreases the volume of the thoracic cavity and pushes air out of the lungs. The diaphragm's continuous rhythmic contractions are essential for life. It is involved in both quiet and forced breathing. The diaphragm's movement is mostly involuntary. However, we can consciously control our breathing to some extent. This control is utilized in activities like singing, playing wind instruments, or practicing certain meditation techniques. Section 5. Beyond normal breathing. Accessory muscles. During normal, quiet breathing, the diaphragm and intercostal muscles are the primary workers. However, during times of increased demand, such as during exercise or when experiencing shortness of breath, accessory muscles are recruited to assist in breathing. These accessory muscles include the sternocleidomastoid and scalene muscles in the neck. These muscles help lift the rib cage. This further increases the volume of the thoracic cavity, allowing for a greater intake of air. Other accessory muscles involved in forced breathing include the abdominal muscles. These muscles assist in exhalation. They do this by increasing abdominal pressure. This pressure pushes the diaphragm upward. This action forces more air out of the lungs. The use of accessory muscles during breathing is a normal physiological response to increased oxygen demand. However, persistent reliance on accessory muscles at rest can be a sign of respiratory distress. This warrants medical attention. Section 6. Working together. Thoracic muscles in harmony. The thoracic muscles work together in a beautifully coordinated manner. This ensures efficient respiration and a wide range of movements. Extrinsic muscles facilitate actions like reaching, lifting, and pushing. They also help expand and contract the chest cavity. Intrinsic muscles like the intercostals and diaphragm drive respiration. they maintain continuous airflow in the lungs. These muscles work in perfect harmony to carry out essential functions.